All right. Governor, how are you doing?
I'm great. Thank you so much, Kemal. It's such a pleasure to join you today. Thank
My
you.
pleasure is ours. I was just going through some of my notes for today's event. Apparently, there are only 19 female lieutenant governors uh,
Yes.
in U.S. and only 9 female governors who are serving currently. So, it's pleasure is ours that we have someone like you who's joining us and
Thank
then
you.
having this conversation with us. Thank you so much. So. I am gonna have our video also running. We are gonna kind of go independently from the video, so that I wouldn't pay too much attention to it.
Okay.
So we want to ask you any hard questions, maybe I don't know. So our goal today was just to better understand where we are in terms of Delaware. And you have been now in this position for the last 2 years, and you have many different positions. You are wearing so many different hats. You are the chair of the National Lieutenant Governor Association, the lead voice for the Behavioral Health Consortium. You are an active nursing faculty, and also with the some of the the new meetings that you are joining with the mental health awareness, youth mental health awareness. So you do so many different things, and then you still do your full-time job, which would be the Lieutenant Governor of Delaware. So how is it going so far?
It's going really well. Thank you, Kemal. I think those of us of kindred spirit who are very committed to the health and well-being of our communities juggle multiple hats. And I think that's the fact of many of those who are there with you at United Health. The many women and men that you employ, I think, juggle to make things better. And for me, it's just been an incredible journey. We can talk a little bit later, but the things I have learned through my 6 years in the House, 9 years in the Senate, and now the past 6 years as Lieutenant Governor about the ways to uplift Delaware and everyday Delawareans, making sure that we have bold plans in place to protect our small jobs and our small businesses, as well as our corporations, but also the health of Delawareans. And we can talk a little more later, if you'd like, about some of the things that brought me to the dance of policy. As a nurse and as a young farm girl from Sussex County who had the opportunity to travel with my husband in the military while I finished my doctoral studies. And, that journey and what has brought me to make sure that with Governor Carney and our General Assembly, that we do have a strong economy. And the last thing I'll say before we jump into, I'm sure, more conversation is through COVID. What did we learn? We learned that the health of our community really determines the health of our economy. And it is just so important that we work together and we do the best models that we can. And I've stolen a few good models from other states around best practices, whether it's in education or healthcare. And I know a lot of eyes have been on Delaware to model some of the work that we've done in behavioral health. So thanks for having me today.
Well, of course. Now, many politicians, they run for positions to serve. So, and in many cases, when they take over, we see like complaints and just blames, and we haven't seen that from you. And I believe this past 2 years, it was challenging for all of us, not just for the state, but for the country and the individuals, companies, as you mentioned earlier.
Yes.
So now you run for this position thinking that you were going to do so many different things. But then when you get to the position, maybe things were different. If I were to ask you, what was the most challenging issue that you have to dealt with in this last 2 years?
That's a really important question. We've had a twindemic across America, and chairing the National Lieutenant Governors Association and also leading the National Million Women Mentors, which is a STEM program. I think the global economy and the global community that we have witnessed with the health And when a twindemic, what I'm speaking about is both the COVID pandemic and our opioid epidemic. Prior to COVID coming, I did indeed, like you said, have the pleasure and continue to serve the state and serve in a caring way that allows me to actually be on the streets as a professor, PhD professor doing research at the University of Delaware, whether I'm in Sebbyville or I'm in Claymont. Really important that we make sure that individuals were protected. And for those who are suffering more mental health and substance use disorders, as you well know, with your work with the ACO and your providers at United Medical, that you've had to really be nimble. And the thing that was most challenging for us was being able to protect our Delawareans while keeping the economy going. And so we kept open our construction agencies and facilities. We kept open our early learning. We did those things that we knew, but doing it safely with the Division of Public Health. And that was a challenge, but also coming forth with smart models. There is no I in team. Collectively, we really implemented some best evidence-based practices in population health. For example, when the first day of shutdown occurred in our state, we hit the streets. I was the undercover lieutenant governor. Nobody knew who I was, covered in full PPE. We had no vaccine at that time, but we went to our highest risk neighborhoods and we did COVID testing and working collaboratively as a team with leaders in the health community and providers. We were able to, with Aquila services, take the most at risk, put them in shelters and help provide services. And proudly, I can say that Delaware was one of 4 states that during the COVID first year of the pandemic and the opioid epidemic, we actually had a decrease in the percent of overdose deaths. We know fentanyl and carfentanil have been extremely deadly, and we were very proud of that. Now, the number of persons unfortunately succumbing to overdose deaths has not decreased. It has continued to rise across America. That's why our Behavioral Health Consortium and the Opioid Settlement Commission that has been formed in collaboration with our Attorney General's office, that we are really putting forth some best practice models for others in the country to emulate. And so those two things combined have really been the most challenging, the opioid epidemic and the COVID pandemic simultaneously.
So now I guess the budget would be one of the biggest challenge also, right? So then you guys have to go through. I don't know if, maybe we should have told people. So you and I, we met first time, I believe, last year at the SBC, the Brandywine Valley SBCA's.
Yes, the SBCA.
Right? So,
yes.
And because, when we do these events, sometimes, I hear people talking about like, oh, they knew each other and they were friends. But we talked maybe 2 or 3 times in this whole last 12-month period. And it was very limited. You came to our office once. We had maybe 2 or 3 phone conversations. So, but many of the people may not know that in 2008, 14 years now. So I was part of the transition committee of Jack Markell. So that's kind of like an interesting concept for the rest of the world because they don't really have that. So, and it was kind of fun for me. It was a lot of learning, but also it was so challenging to understand how the budget is made because I'm running a private company. So for us, if you have it, you have it. If you don't have it, then you are out. But for the state or the country, it's not in the same form. So you have to still provide certain things. You have to borrow certain number of loans and other things that you still have to provide. So how did you guys overcome the budget issues? Now, just to give you, just a simple number. When I did this transition committee time, the budget was under $3 billion. And our population didn't go up much in the last 14 years, I don't believe. Right now, we are at 4.7 billion. And so this increase is a very big increase. And you and John Carney, our governor, you guys are dealing with this challenge because there's no income coming in other than our taxes and other, other stuff, right? So how do you overcome those challenges?
Well, I've had the opportunity, like you said, to serve budgetarily on the state budget bond committee when I was a member of the legislature, and you're spot on. Thank you for your service with Governor Markell, who did a fabulous job of reminding us almost every day that we are a small state of neighbors. And I had the honor this past year to oversee what is known as the complete count, which is actually the census for Delaware. And we are around 11,000 shy of 1 million persons. We're at 879,000 or so in our state, and or 89,000. We really, truly have a state where we've had the opportunity proudly to keep a triple rating in our bonding. I can tell you, sitting at those committees during 2008 to 10, when we suffered the Great Recession under President Obama and the leadership then of Governor Markell, and then in our first year with Governor Carney, the true budget deficits that we faced, it was very hard. It was very hard. We didn't have funding for the infrastructure. And right now, for fiscal year 23, it's around a 5.1 billion operation, of which we had 370 million in one-time supplemental appropriations. And again, we were able to do good things with those extra funds. And a thank you to our congressional delegates with whom I know you have worked closely. Congressional Congresswoman Lisa Blunt Rochester, Senators Carper, Senators Coons, who sent to our state through both CARES Act and ARPA dollars the opportunity to infiltrate and very important both one-time capital and other operations funds. And when Governor Carney had tapped me to lead statewide hearings, I had to host approximately 11 hearings in like a couple of weeks. And it was a painful time. And it was when small businesses in particular, which are the economic drivers of our state's economy, it was challenging. And so we listened, and collaboratively working with the General Assembly came forth with a budget that would not only have implications for the current time, but actually elevate and uplift and put monies back into the economy. For example, in fiscal year 23, we did around 104 million extra dollars for a 3% pension increase for former state workers. We've also implemented, thanks to Senator McBride's leadership, the first launch of some of the funds for medical leave for families. And one really important item for me and for you and others is making sure families have support through early education, not daycare, but early education for brain health development of our youngest birth to 5, and putting that into equitable communities. The one thing I did not mention previously when you asked about what the challenges are, we saw through COVID the gaps in equity in Black and Brown communities. And so while you laid a vision out, thank you for that, during Governor Markell's transition, we have had to have a vision to the future here in Delaware now. And we have this opportunity in our budget to begin to also look at equity across the board, but doing so in such a way that we're also very mindful for entrepreneurship and for both large corporations as well as small business. And I know you've worked with, our prosperity partnership, our, corporation section, our division of small business, minority owned community and based businesses, to really make sure that these funds were dispersed equitably across all 3 counties. And I could go on a while about operational budget, the capital budget.
So I think we can probably, I can help you with with a couple of questions.
Sure,
maybe
absolutely.
with the budget to the most expensive items in the budget.
We know what they are, don't we?
Right. So the public education, about 36% of the budget where we spend.
Yes.
And the second biggest one, where I believe that maybe I have a better understanding from the healthcare side, as we are the healthcare providers, health and social services. This is like 27% of your total budget, and between these two, it's more than 60%. So that's a lot, right? So Now, what I was going to ask you is, number one, actually, from the healthcare, health and social services, I do want to actually compliment the state of Delaware running a really efficient Medicaid program. That's, I'm not running for the office, so I'm not in the office. I don't have a horse in the race, and I do openly criticize politicians. But I think what we have done in Delaware, especially in the last 14 years, the very efficient Medicaid program, which is really important because our Medicaid population did go up, is going up. And then also the state being the biggest employer. And then therefore your health expenses are also really high from that point. And of course we have the other in the open market, the exchange market, whatever we call these days. So you have so many different challenges there. Some of them we are doing really good. Some, because we are the small state, we have some disadvantages.
Yeah.
So I think maybe focusing on the healthcare, I want to kind of better understand if there are anything that we can, from the private practices standpoint, we can do, or maybe you already have other plans for the future of healthcare, just to kind of better understand where you are with the healthcare.
Yeah, well, excellent points. And, as a professor of health policy, I could take the whole day talking about, the health system. And I want to compliment United Medical, you as an ACO, looking at value-based performance. And I don't want to get into the weeds for all the viewing audience who maybe not get into every one of the dry terms in health policy systems, but we have to look at collectively the changes that we need to address. And I love the slides that you have provided today around obesity, social determinants, and the Lieutenant Governor's Challenge is one exemplar of one program that might be employed to help us to look at cost and elevation. Think about it, prevention. We all talk about it. We hear about it. We learned about it during COVID, whether persons were vaccinated or not. Thank goodness, Delaware, we had a strong vaccination rate. I was honored to personally vaccinate over 4,000 Delawareans myself. After working 363 straight days, we made sure that people have what they call primary, prevention, which was our immunizations. Let's face it, if everyone did screenings and everyone did exercise according to our standards, our obesity level would not be 30-some% in our Middle County, Kent County. That leads to other chronic morbidities like diabetes, like heart disease. All of those things escalate costs. And thank you to United Medical and your practices for trying to implement standards of disease management and self-care management. But again, that takes also not only physical health, like the Lieutenant Governor's Challenge, which is both physical and emotional well-being. And during COVID, the social isolation, the increase, unfortunately, in suicide ideation, all of these things impact our health. And physical health is so incredibly important. And as you said, spot on, just behind public education is Delaware's health budget. 1 in 4 Delawareans is on Medicaid, which for the listening audience is supplemented by both state and federal government. It is not a bad thing, but it is something that one would need to make sure we manage. Thank you to United Medical for trying to really manage services to make sure persons have those wraparound care measures. And so in Delaware, for healthier care, we've really worked hard to have a runway of options, right? So, we want to avoid the cliff of persons having a stroke, a heart attack, stage 4 terminal cancer. We want to avoid that. And having worked with Governor Minner, when she was our first female governor, working with her, I learned a great deal about the importance of prevention and funding. And just like with cancer, we've also tried to do collectively with other diseases so that we don't get to the end, but we have the screening, we have the prevention, and we have the overall education. But what good is that if you do not have access? And that's where your social determinants come in, whether you have transportation or your housing is sufficient or you have food on the table. We've tried preventative and continuum secondary measures by being one of the few states in the nation that has actively deployed community health workers or ambassadors. And thanks to United Medical and others for looking outside the lens to talk about having persons from the community or the nurses, who I'm biased for, since I'm a nurse, I'm very biased for the nurses who do the care management, to say, hello, have you gone on your appointment? Are you exercising, 5 days a week? Are you monitoring your blood sugar? Et cetera. So in Delaware, those things are extremely important to me. As I round out 2 more years in the completion of my term as lieutenant governor, the challenge is open to anyone. And I'm hopeful after your podcast today that in our next round, we did just recently going to be announcing some of our winners for this year, but we have a systems approach where an individual, a school, a faith-based organization, an employer can apply and get the Lieutenant Governor's Challenge Award, which is important. And it can be environmental health, it can be physical health, emotional well-being, and certainly maternal child health is a highlight as well. So that's a lot. So you see the runway of prevention all the way to the end of life care and services.
So, it's as I'm listening to you, just going through what we do day to day, and some of these things, because we do it every day, it's kind of like the norm for us.
Yes.
But I just want to kind of step back and then just acknowledge the fact that pandemic actually changed our lives forever.
It did.
And a lot of people lost their lives, and a lot of people suffered. But there's always this optimistic person in me, and I'm always trying to see some silver lining. And I mentioned this in so many other sessions that we have. One is the utilization of technology, telehealth, the remote support of the patients. We advanced almost 100 years in this last 2 years in the virtual health, how we are able to provide that. And both sides were open in this case, the providers and the patients, because we understand that this is not something that we just should do it as a luxury. It's a need. So I always tell people, because we do this every Friday, my 2 parents, 71 and 81 years old, and I tell them, don't, go to the public places without a mask. So This is not about COVID anymore, because we forget that we had 40 to 80,000 people were losing their lives from flu season time. So now we learn a lot of good habits, and from that, the other thing that I wanted to kind of maybe spend a little bit of time on, which I believe I see this as an opportunity. You may know this or may not, but on Fridays we have 2 events. 2 p.m. is this very event that we are doing, and 3 p.m. is, we call it Bariatric Friday.
Okay.
And, we have one of our bariatric groups. One of our groups is the bariatric group, which is this year they are celebrating their 20th year.
Great.
And we have a surgery center called American Surgery Center, and we specialize in bariatric surgery. So part of my day, I spend a lot of time with the case conferences. I go through the cases with our nurses. And Dr. Aziz Erkan, who joins me almost every Friday for the 3 p.m. event. In fact, except that today he's in Italy. Next week we'll resume. So as I'm spending so much time in these specific topics, I also have the background of the healthcare overall. So, and I know that, it was 1998 when I came to the United States. Mm-hmm. So in year 2000, I started in healthcare. So when Sean was helping me to prep for some of our slides, I was telling him in year 2000, so we ranked 37, being the worst in the low, a high number is better in obesity in the United States. In 2020, so it's 20 years later, now we are in the top 7. Mm. So, and I said, well, perhaps I'm the reason that we are getting, we are gaining more weight. So, because this is clearly there is something wrong with this number, right? So although this number is really not to our advantage today, but I also see the opportunity that means we are able to improve that. Like, again, with our Bariatric Fridays, one of the things that Dr. Erkan explains, and, again, Sean is going to join us, like he's in my room right now, but he does have a question for you later on. So one of the things that we were planning is those events that we do, there are a lot of clinical information. So we want to have partnership with the colleges in the nursing department or population, I think it's public health departments, so that we can actually have better outreach. And the other outcome, the silver lining that came out of these pandemic the duration is these events. So we are now doing this every Friday. It's like a TV channel here. So
I love it.
we had so many people join us, and we started to do this for our patients first, but then we said other people are also benefiting. One of them, last week we had Freedom Blue Highmark. They joined us. And I know state retirees is part of that. And we are participating, and we are maybe one of the first ones who sign up that agreement with Highmark. But we use this channel as as a tool, a vehicle to reach out to others as well. So knowing, going back to the morbid obesity or obesity and seeing how bad that number is, and also being on the operational side of that, only 1% of the people who are eligible for bariatric surgery, which is the most efficient way to solve the problem, only 1% is going through that. Mm-hmm. And there's also the stigma of obesity. So patients are very sensitive. And not only that, sometimes even physicians are kind of shy to bring that up if the patient is not complaining.
Yep.
So then this social determinant of health becomes so essential, because if you really don't understand, if you don't have the situational awareness and understanding what patients is going through, what they have there in mind, I believe providing the care will be always challenging. But on the obesity side, do you have any plans or do you have any suggestions that we can do perhaps differently for the future?
Wow, I love that. And it's so important, food insecurity and food deserts and all are so real. And some of our awards, the Lieutenant Governor's Challenge, have spent a lot of time on addressing issues of obesity, issues of food insecurity, whether even on a college campus or into the community, or we've done creative things like gardening, et cetera, so that persons have accessibility to fresh fruits and veggies and a healthy lifestyle. Not everyone can go to the gym. Not everyone is able to do such physically, but making sure we have those activities available and in place. For me, there is nothing more opportunistic than addressing the challenge of obesity, and you cannot blame yourself for that. I think as we've all become more sedentary, there are devices, and individuals are not as active. And I want to say that it is paramount, and I'll come back to your point later about telehealth. I was the bill sponsor in the Senate for telehealth, and it was a fight at first. So sometimes things that become useful start off in the policy world as a challenge. And I do believe that as we become more cognizant of the importance of primary, and again, not to get technical in the weeds, but primary prevention, education, and reimburse for these things. It is a lot more reimbursable by companies to get more funds for an expensive cardiovascular or diabetes drug than it is a vitamin. It is also, there's more incentive around, and we have to look at why you are doing what you do with an ACO and value-based performance. I am 100% committed to the value of community-based workers in the field, or true telephonic, regular visitation through whether it's nurses or ambassadors through our communities where people work, play, pray, faith-based entities. That is where the rubber hits the road often in lifestyle. Work sites, where they pray, play, and all of those arenas have to be considered. I can share with you that in 2002, the first year I swore into oath at my office, I chaired Disease Management Committee. There were recommendations, some of which have been implemented, some of which continue to need to be implemented. Later, in around probably 2006 or so, I had the opportunity to work with a stroke commission and looking at prevention. It all goes back to accessibility to fitness, accessibility to appropriate food, and we have a job to do. That's why my office, as a member of the legislature, fought really hard to get TANF and those who have to have supplemental nutritional support by our government, cards that allowed them to go to our farmers markets, to go to places where they had healthy choices. You know, it's a lot right now. Gas is expensive, grocery prices are higher. I'm working now, my office is, to get infant formula shipped here from Australia. I mean, there's a lot going on. So Kemal, to answer you at United Medical, the wraparound, the follow-up, your care management are absolutely critical with the obesity. And it's not just enough to talk about it. It's so important to have someone holding someone's hand to motivate and to walk them through.
Yeah. It's at least, you know, what's really important for me from what I'm hearing from you, honestly, it is, it's extremely important for us to have someone in charge who knows what healthcare providers are going through day to day and understand and help us to remodel, in some cases, what we are doing. You know, we started with the triple aim, and I said triple aim is never enough. It's like quadruple aim because there's the provider end of it. So as you know, we have a provider shortage, primary care shortage.
Oh, the workforce, absolutely. And I know you've worked with Senator Townsend on that.
Definitely. So, and I also own a primary care office, maybe one of the largest ones. But what I see is the burnout from our physicians, because it becomes even more and more challenging every day to provide the care that's needed when you don't have enough number of people, number of providers. So, I mean, we are really trying, and I'm always optimistic. I'm a positive person, but knowing someone like you who's in charge, and hopefully maybe even in the future, maybe we're going to see you in the governor's seat and maybe the other positions. This is really important for us. That you are able to understand, you actually maybe not understand, but you even know better than we do some of the challenges that we are going through. Now, you know, pandemic really did have so much damage on us. One of them is on our memories. So I feel like sometimes like this 2 years never happened. And then
right, like a brain fog, like a fog, right?
I had to Google how many female governors or lieutenant governors we have, but I forgot that we had Governor Miller as the first female governor of Delaware. You mentioned her name, and then I'm like, oh my God, I forgot that. And then, you know, I actually met her several times in the past. Now, are you going to be our second female governor?
I can share with you that right now we're getting through the November cycle, but I can say if we were actually in my other office, where a lot of times I would be taking the Zoom instead of there is a wall of pictures of lieutenant governors who have gone on to be governor. And I hope that one day I should join that wall. How's that? To say that it is in the horizon. And once we get through this cycle this year, we can have further conversation. But I do envision a continued commitment, you know, a calling to serve the state and to really continue to uplift Delaware. You know that I am a healthy, competitive person working across the nation with the national lieutenant governors, as you mentioned, and STEM. And I know we have some great models here in not only healthcare, but in education and environment and other programs in agriculture, et cetera, that really we are being emulated across America and bringing models. But we have a lot to do, and I would love to be able to continue to serve at a higher capacity for sure.
Well, it would be my promise that we would be fully supporting you in the future, and
thank you
having
very much.
dialogue and knowing that at least we are heard and we are understood. That's so important for us, and it would be our pleasure to be able to help you in the future. Now, Sean Donovan, you met him, as I mentioned, he's right here with me. So now we have this TV set up like my office is. So I'm going to ask him because he did have, he's from UD and you taught at UD, and he had a question, and I told him that we would have him in.
Awesome. Hi, Sean. I love my UD students, my other life, my other full-time job. Yes, good to see you.
Good to see you again as well. Yeah, no, just as Kemal mentioned, I did have some questions and talking points that I was kind of curious about, and it might be a little bit backtracking that you may have touched on a little bit earlier. But kind of just wanted to say, you know, over your many years with the UD nursing program, which I did take some prereqs and some intro nursing classes during my time there. So I'm a little bit familiar with the beginning steps into that nursing program. But what changes have you seen education-wise over the years, and how are the students who are on track to become future nurses kind of have to adapt? And kind of, I'm also going to overlap this with some of the public health lessons I learned in those courses I took along with public policy, in sense of it being an upstream battle that
I lost you there for a minute, Sean. I've lost audio. Can you hear me? Uh-oh. I have lost audio. Can you hear me? That's strange. Oh, now you're back.
Oh, all right.
Are we back?
I got most of it. I got, you know, how things have changed, and you learned a little bit of population health. Now you're back. What was the end of that?
Yeah, so I'll just kind of read, not the whole question, but the second part of that question was kind of in terms of public policy. And we know that there's a lot of, whenever we face challenges, we want to address them kind of in the upstream, where it's kind of at the source. That way later on, you're not facing the same repetitive issues. So I was going to say, if you could kind of blend that in the sense of education, what changes you're making in terms of our students who are on track to be future nurses, you know, who are involved in healthcare in the future. What changes from the educational sense have you seen over your years with your involvement in the program and in healthcare?
Sure. No, that's a great question, and thank you. You know, and again, having taught here at the University of Delaware and at Professor Sumford Jefferson and Medical University of South Carolina and George Mason in Virginia, you know, there have been trends, there have been changes. The one thing about the University of Delaware, they've always been light years ahead on technology, and I have to tell you that our technology has been remarkable at UD. You know, when I came in '96, it was sending big tapes, but we were sending tapes around the globe for nurses to do more what is now known as online learning. But we do see a lot of much more student-driven, online, out-of-the-box clinical applications than we did before, whether it's nursing, physical therapy, allied health. And I teach not only in nursing, but I teach, for example, right now I'm teaching an ethics and law course that has pre-med, social, it has all levels of outreach, respiratory therapist, social worker, you know, you name it. And we really are having to do a lot with our clinical placements, a little more challenging some, but also more opportunistic. I've always taken students where no one has dared to go in population health. So I've had to have students in very unique settings. Some have been fun, like in Fortune 500 companies with the Eagles and other places, and our big banks and occupational health and therapy. We've been certainly in our correctional institutes. I've had them on the community streets with me in mobile units and mobile vans, and really being the prime provider. Nurse practitioners, which I teach in the doctoral and master's programs, are a primary provider. As Kemal, you indicated, when we did legislation this year in primary care, the collaboratives between physicians and advanced practice registered nurses are critical. My first doctoral student at the University of Delaware in nursing was a certified nurse anesthetist. He went on to be the president of the National across America of Nurse Anesthetists, and his dissertation actually changed practice in Delaware, but across the country. And so what I'm getting to is that education is much more integrated immediately with clinical outcomes and policy changes. 30 years ago, a doctoral student's research may not immediately result in a collaborative change in agreement at a policy level and a state general assembly. We also did not always see students who were venturing out more autonomously under preceptorships. That has absolutely changed. The challenge we continue to have here in Delaware, as you have and as other colleagues have, is the issue of appropriate salary for recruitment and issues dealing, as Kemal mentioned, the burnout, the retention. It was very hard during COVID. I myself, did the 363 days, and when the mask came off, I saw the face, and I know that people feel that level. In January of last year, when we had the second big surge, I volunteered and took students into 2 of our hospital systems downstate, to the emergency department, to overflow packing units, to rooms that were created because of the surge. There was such overflow and from the ICU. And so, students have to be more nimble. They have to be more autonomous and self-directed in learning. And, students also have a much more rigorous set of standards, because we want them to not only finish with a bachelor's, we really hope that they're getting their master's and their doctoral degrees. And the biggest challenge we face as in academia is having enough educators, particularly in nursing. So it's the challenges you all face, the things you're trying to do at United Medical. And I think the more we can do clinical partnerships with mentoring, having the nursing students involved, or a social work student or physical therapy student involved at every level, and including the home situation and scholarships, and starting at a younger age. I know you all are very involved with the recruitment programs that the state has set up, where we're going into the middle schools and into the high schools to talk about career pathways, really important. And also working from communities through the community, because you can't do anything to the community, you can't do things with the community, but through the community, going through the community to recruit persons who look like the community. So we have got to continue to diversify our workforce, and to make sure that the workforce looks like the demography of our state and the demography of our country.
We didn't give you these questions for you to kind of just readily answer. And as I'm listening, I'm like, okay, so this is someone who already knows what's happening in Delaware and in healthcare, at least from our point. And
thank you. Thank you. I kind of throw myself in it.
No, this is great. Honestly, I personally enjoy having you on our show, and being able to share with other people what you do and what we can do together. It's what we are looking for. And we want you to know that we are here to support Delaware.
Thank you.
Although I was not born here, this is my home. I never left Delaware since 1998. So that was before Sean was born, I guess. Yeah, so my whole adult year is here. So this is really important for me. And I'm hoping that we can actually do a lot more together, and we can support you better. And
I appreciate that. I really do. And the work that you do is so important. And I think as you do the physical care, really integrating that mental health, the behavioral health is so important. And thank you for doing that and recognizing the value of to have a healthy economy, we have to have a healthy community.
Well, pleasure is ours, and thank you again. And we'll hope to see you in maybe next couple of months.
Yes.
And then maybe discuss some more specific topics. Thank you again. So we'll see you soon.
Thank you.
Thank you.
All right, so yes, she just signed up, so very good.
Okay, good.
So I got better at this now. I know. I don't think that I can see the distance. So,
No?
so she was great. Honestly, knowing someone like her, I mean, you see, like, especially your question was kind of like not something that they were expecting, and being able to answer these questions in the way that they do, they really need to know their stuff. So
Yeah, she answered that at all levels, past, current, and future plans.
And it was also, we asked her for 30 minutes, so it was almost an hour session. So we also appreciate her time. So it's always good to see our state officials to hear what we have to say and understand what we are going through. And also we want to voice out our provider's voice, our employees' voice, and hopefully we can do better all together in the near future. So today we won't go into our global events and the U.S. economy. Well, we kind of discussed the Delaware economy almost, right?
At least.
So, but we'll be back next week with our new updates, and also Bariatric Friday will be back next week. Thank you for listening, and thank you for being with us. We'll see you next week. Bye-bye.